Reham. Thank you to visit us here in Luxembourg. Can you introduce yourself and tell us what you do for Handicap International in the Gaza Strip?
Okay, thanks, Nicholas, for the invitation, and it's really my pleasure to be here. I'm Reham Shaheen, and working as a regional rehabilitation field specialist based in Gaza, Palestine, and I'm working with the humanity and the inclusion in Gaza since 2014. In my position, I'm responsible in supporting the rehabilitation staff at the partner level and HI staff to build their capacity and train them in order to provide quality rehabilitation services for the affected population, either in emergency situation or non-emergency situation in the protracted crisis in Palestine. Moreover, I am supporting advocacy efforts in order to raise the voice of the population in order to ensure that the services that they need are provided for them and matching their needs. In addition to contributing to some fundraising efforts, also to ensure that we have the sufficient fund to respond to the holistic needs of people in Palestine, and in specific in the rehabilitation sector, which is my area of expertise.
Okay, thank you. And with the terrible situation we see the last days, can you tell us about the consequences for the civilians, about the use of explosive weapons in populated area, like in Gaza?
Well, so the situation in Gaza Strip is really drastic. It affects the life of the people living in Gaza, and mainly the civilians. After this escalating situation since 5 days and the use of the heavy explosive weapons by air and land, targeting the housing units of civilians and the public infrastructure in Gaza Strip, this led to a huge number of casualties and fatalities. So according to OCHA reports and the reports of the Ministry of Health, we have more than 1,300 people killed, in addition to more than 6,000 people injured. And also this bombing enforced the people to flee from their houses, which supposed to be a safe shelter for them to protect themselves from the bombing and shelling everywhere. So they enforced to flee to the center of the city for a safer shelter, and now they are moving with thousands of people to emergency designated shelters managed by UNRWA, and in addition to hosting communities, which are relative houses in the center of the city. Those shelters are overcrowded, have thousands of people with lack of essential needs to respond to the need of civilians. So lack of water, lack of sanitation, lack of food, lack of mattress and blankets to protect them from the winter or the cold, because now we are expecting the winter soon in Gaza, and usually the autumn season for Palestine is cold in the night. So the essential needs are of the population are not met within these shelters. Moreover, if we are talking about the impact on the psychological well-being of the population, this status of being under bombing and shelling cause anxiety and distress for civilians living in their houses or living within the designated shelters, because they are expecting that they will be killed anytime, in any single moment passed on them. They expected that they will be the second person who's killed or injured. So this put the people in a severe psychological condition, and we can't neglect the impact of this stressful situation on the children who are in this situation, don't feel safe, can't feel protected, which put them in severe stress that can affect their normal development once this escalation ends. And if we are talking about the impact of this drastic situation, it impacted badly the provision of services and the system itself. So the shelling targeted the hospitals, targeted the schools, targeted the designated shelters, targeted everything moving in Gaza Strip, including the ambulances, the civil defense cars, which supposed to rescue the civilians who exposed to the shelling and injured. So this situation is really difficult to describe and really feel speechless to express what are the difficulties my people face nowadays. They lack the access to the essential needs, which is the water, the food, because now Israeli decided to cut the supply for electricity, the food and water to the civilians living in Gaza, which aiming to end their life, while they should enjoy this right to access to their needs according to international human laws. And
Yes.
if we
And what are the situation of the health services and the health facilities?
As I told you that the bombing
Yeah.
even started to target the health facilities and the health workers. So according to the WHO reports, more than 11 health workers were targeted, including the ambulance drivers and the health staff who's working inside the ambulances to rescue the people and to provide the first aid for the people at the event of the incident till they are transferred to the hospitals. Moreover, in the situation of the cut of electricity, which impact badly the operation and functionality of the hospitals and the health facilities. So the available amount of power can only operate the health system for 24 hours according to the UN and OCHA reports, which means that the health system will not be able to respond to the needs of the 1,000 people injured coming every day to the hospital in order to receive the emergency medical care. And this situation is life-threatening. The health system is really fragile before this escalation due to the blockade since 2006. And adding to this fragility of the system, now we have this number of huge casualties coming to the hospital in need for emergency medical care that they can't receive because the bed capacity is lower than the number of persons with injuries. And also the Ministry of Health and the health system also doesn't have the number of or the sufficient number of health professionals, doctors, nurses, physiotherapists who can respond to the needs, the medical needs and the health needs of the people with injuries. And we will not forget also the impact of the situation on the people who reside inside the hospitals, who receive the daily treatment, like the oncology patients, the children who are in the incubators, who supposed to receive the health services in the normal situation. Now they are not considered as a priority for the health system. The health system now prioritizing persons with injuries in order to prevent the further complications of the wound and also to prevent the disabilities. So they are imposed or enforced to discharge the people who are in the inpatient units in order to empty the beds to welcome new injuries and respond to the emergency health needs, which also caused life-threatening issues for people having health conditions not related to the conflict, but also their lives are impacted by this situation and escalation, which paralyzed the life in Gaza Strip. Also now the power plant of Gaza Strip stopped working because now there isn't fuel to operate this station again to support the hospitals and the all services like the sanitation and water to function again, which means that Palestinians will not be able to survive in Gaza Strip after the 24 hours if the humanitarian aid doesn't enter to Gaza Strip in order to help them meet their essential needs, which is the food and water. So I think it's now the time in order to put a pressure on the two parties to stop this violence and at least to respond to the immediate need of the population to keep them alive in order by allowing the humanitarian corridors to allow the goods and other medical supplies to enter Gaza Strip.
And before this escalation, what were the main needs you were facing in your day-to-day work? What was the needs you want to answer?
As a humanity,
Yeah.
humanity and inclusion. So the needs are diverse, and as a humanity and inclusion is working with the most vulnerable people in Palestine. And if we are talking in specific about Gaza Strip, so we are prioritizing the most affected population. We are talking about persons with disabilities, persons with injuries, women, men, children living in vulnerable situation and with poor economic conditions. So the needs are diverse because, as I told you, that Gaza is under the siege since 2006. It means also that the different structures and systems are unable to respond to the huge need of the population. So the employment rate is really high in Gaza Strip. So people can't have the possibility to earn money and get the livelihood opportunities to support their families. Children, not all the children have the opportunity to go to school because the number of schools is not sufficient comparing to the number of children who are in need for to access education. And sometimes some families can't afford the symbolic fees of education services if we are talking about the kindergartens. Moreover, the health system is impacted by the blockade. It means that they can respond to the urgent and immediate need, but the long-term needs can't be met by the systems. So as a humanity and inclusion, we are working in this zone in Gaza Strip in order to complement the services provided by the system and other NGOs and INGOs, prioritizing the needs of the most vulnerable people. So the needs are shelter, education, health, and rehabilitation, early child development, the need for food security, and each eye within our action in Gaza. We have all these services as a core sectors of our intervention. We try to respond to the needs of the people with a prioritization criteria. We know that the needs are huge.
Okay, and you're here in Luxembourg, and thank you again to be here in these difficult times. You live and you work in Gaza, and for us, Gaza and all this conflict, it's more pictures, it's more news on the TV, but it's quite far away from us. So you are the voice of the civilians here, and what kind of message do you want to deliver here in Luxembourg?
The first message: stop violence. This is the first priority in order to start the look to the needs of the people. We are inviting for a ceasefire, and this is what I wish. First, ceasefire in order to save the life of the people who stayed alive in Gaza Strip. They are alive physically, but psychologically they are dead. They need long term of intervention in order to recover from what they already witnessed in this escalation and the previous escalation. So stop the violence and then ensure that the support is there for the civilians living in Gaza. And then also put more pressure on the international world in order to ensure that this violence is not repeated again and the civilians in Gaza are not exposing for more violence in the upcoming years, to ensure that the new generations live with the hope and can build their societies to be ambassadors for their countries and contribute also for the prosperity of this world, because we have the ambition, the dreams, and we know that we can build in this world and create the change.